Meanwhile, President Trump is announcing his long-awaited health care plan. The president's promising to send money directly to Americans, bring down drug prices, and lower insurance premiums, but so far he's not offering specifics on how that would work. Now, Democrats are dismissing the plan as more empty promises from the president. ABC News' Elizabeth Schulze is here with more on that. Hi, Elizabeth. So how is this new health care plan supposed to work?
Hey, Dan, and this is a plan that the president has been teasing for years, saying that he has an option to try to bring down healthcare costs for Americans. Of course, we have seen prices for many Americans skyrocket since the start of the year when those expanded credits in the Affordable Care Act expired. So what the president is proposing here, as you say, light on details, but it seems to center on this idea that the government would put money into a health savings account for people, and then you could use that money to buy health insurance or other expenses. The fact sheet that was released by the White House also talks about the need for insurance companies to be more transparent about their pricing, to be clearly publicizing their denial rates, how much they are offering for coverage. And it would also codify into law, Diane, some of these ideas that the president has been pushing on his own, trying to get companies to offer drug prices at similar rates in the U.S. compared to other countries. This has been a big focus of the president's, putting this pressure on private companies to bring their pricing in the U.S. more in line with what you might see in Europe, for example. So this is something the president has said is a key priority. He is clearly trying to message that, but a lot of questions about how this would actually work. And at the end of the day, the really important point here, Diane, is that this would need to be passed by Congress. This would need to be put into law.
So how's the president saying he wants Congress to consider this? What happens next?
Right. So the White House is saying they're having conversations with people on the Hill, but a lot, this is an issue that we have seen a lot of back and forth with. And at the end of the day, even the momentum that we saw in some of those expanded ACA subsidies, that has seemed to be fizzling a little bit. So this is going to be an uphill battle in many ways. We saw a similar proposal from Senator Bill Cassidy, a Republican, when it comes to these health savings accounts. That was last year, did not get enough votes to pass the Senate. There is an understanding, Diane, in Congress that something needs to be done about these health care costs. When those subsidies expired at the start of the year, 20 million Americans saw their premiums go up, many as much as doubling, sometimes more than that. There is a concern that people will look at their bills as they start to see those bills come in this month and in the next few months, that they will say, this is simply too high for me, and they'll drop insurance altogether. So we're seeing a lot of proposals. We have seen proposals on the Hill. How much momentum now that the president has kind of thrown his support behind these ideas? That's what we're going to be watching for the days, weeks, months ahead.
Elizabeth Schulze, thank you.